Next patient, room 14 by the window. Snoop Dogg, 46-year-old male with a recent diagnosis of congestive heart failure and AFib. Past medical history of diabetes, hypertension, positive smoker, ETOH, and marijuana abuse. Put in for morning labs and to begin digoxin treatment today. Patient in need of ditch education, has a history of poor med compliance, comes from a poor socioeconomic background and education level below high school. Attempt to educate on the patient level.
educaiton.
Class of 2011.
Pharm 203.
Assessing for dig, tox, dig. Assessing for dig, tox, dig. Assessing for dig, tox, dig. Assessing for dig, tox, dig.
Romans employed it as a diuretic, heart tonic, emetic, you better not forget it. Poison tipped darts used on a certain fellow. Van Gogh got down with swirls of green and yellow. Fixing failure, fib and flutter, saving a heart like a knife through hot butter. 300 years of this drug in our lives, helping our broken hearts, now that's our prize. Enhance cardiac contractility and slow the conjunction right here and now. Digitalis can help the function.
Assessing for dig, tox, dig. Assessing for dig, tox, dig. Alright, report just be ending. Finish your coffee, stop pretending. You know what to do once you hit the floors. It's med time, you little nerd in your white coat and green drawers. Pull out that digoxin. Pharmacy just restocked it. It's time to flex those 5 rights. You know the ones you learned in clinical learning lab when you rookies had to repeat the competency once or twice. Your drug, digoxin, those 125 mics. You're out, PO, time 5 p.m. Double check the right patient before your next occurrence. I'm sorry, JGB doesn't get them. And of course, at this time, keep patient education in mind. It's all about assessing parameters, the cardiac kind. If apical pulse less than 60, hold the dig, it can wait. Get the doctor on the phone so he can reevaluate. Listen, I could rhyme till I'm cyanotic, but none of you lames try it. I'm here to put dig tox on blast and make sure we all pass. But on a serious note, dig overdose can be fatal, so don't be skipping steps. Patient education is what I'm preaching, so we put dig tox to rest. Okay, first rep those 5 rights, then log into McKesson. Monitor those lab values to make sure you're assessing for dig, tox, dig. Assessing for dig, tox, dig.
Digoxin is a drug that can help so many hearts, but at the same time can make them fall apart. Usually heard when there's too much drug, it can creep up on you just like a bed bug. So many symptoms to tell there's too much dig in your system, you gotta look them up. Difficulty breathing when you try to lie down. Halo rings while you're looking all around. Visual changes are the most defined, but lack of appetite is not hard to find. There's nausea, vomiting, and even some fatigue. Just remember, folks, this drug's a big league. Dizziness, agitation are some of your cares. Too much of this drug can cause you nightmares. Only take this med if your doctor says so, cause there are interactions that can cause a no-no. Verapamil, quinidine, and amiodarone, indomethacin, alprazolam, and spironolactone. All of these meds, when added with dig, increase the tox levels and make them real big. This little message isn't supposed to make you scared, but if you're messing with dig, at least you're prepared.
Assessing for dig, tox, dig. Assessing for dig, tox, dig.
2011.
Make sure your doctor knows if you are using diet pills, steroids, nicotine gum, Ritalin, St. John's wort, Synthroid, diuretics, heart or blood pressure meds, or medications to treat cancer. You should not use antacids at the same time you're taking digoxin. Make sure you take the prescribed dosage and don't change brands of digoxin without consulting your doctor. It is best to take digoxin on an empty stomach. If it does upset your stomach, you may take it with food or milk. You should check your pulse prior to taking this medication to make sure it is between 60 and 100 beats per minute. If you miss a dose, you should take it as soon as possible. If more than 12 hours late, skip the dose until next time regular dose. You should not use 2 doses at the same time. If you miss your dose for 2 days, call your doctor. Make sure your doctor knows if you are pregnant or breastfeeding, or if you have kidney disease, too much calcium in your blood, or thyroid disorders. Tell your doctor if you are on dialysis, have had a recent heart attack, or if you have recently been vomiting or had diarrhea. Your doctor will need to check your blood or urine at regular visits while you're using this medicine. Be sure to keep all appointments. Make sure any doctor or dentist who treats you knows you're on this medication. You need to stop using this medicine several days before having surgery or medical tests. This medicine may make you feel dizzy or drowsy. Avoid driving, using machines, or doing anything else that could be dangerous if you are not alert. Do not stop using this medication suddenly without asking your doctor. You may need to slowly decrease your dose before stopping it completely. Call your doctor if you have any blurred vision or yellow-colored vision, confusion, weakness, irregular heartbeat, shortness of breath, numbness or tingling in the hands, feet, or lips, nausea, vomiting, diarrhea, loss of appetite. If you notice these or less serious side effects, such as headache, unusual thoughts,